I know you sent us. I know you sent us your bio, and I apologize, but I don't have it. But I do know that you are a member of SALA, Southern Arizona Legal Aid, and I kind of let the group know what you're doing. I apologize for not giving you a better bio, but what I would ask
That's fine,
is,
Kent. No worries.
Your colleague. Before you get started, though, you missed our introductions. You need to tell us your favorite place to vacation along with your colleague, and then kind of start your presentation.
My favorite place to vacation is Oceanside, California. And this is my colleague, Olympia. Like I said, she's our new attorney in the Expungement unit. Olympia, what's your favorite place to vacation?
DC.
DC is hers. So hi, everyone. Can I get an introduction for everyone first, or do we not have time for that? It looks like there's 26 people, so maybe not.
Yeah, that's how we started. Yes.
That's fine. Okay. All right. So hi, everyone. My name's Katie. I'm assuming that you got my bio, kind of describes a bit about my background and what I'm doing now. I was in private practice for about 11 or 12 years here in Pima County, briefly in Maricopa County. And then I got back to Pima County in 2018. Was a domestic relations attorney at SALA from 2018 up until August of this year, representing victims of crime and domestic relations matters. And now I am happy to be the senior attorney in our new expungement unit. We're really excited to be doing this work, and our primary purpose in the formation of this unit and the work that we're doing is to reach folks in the rural areas. I don't want to say outlying areas, because for people who live in a county that like maybe Maricopa or Pima would consider outlying, it's not outlying, it's their home, right? Like it's there from their perspective, everywhere else is outlying, right? So I think that's I just don't like that term. I grew up in small towns through northern Utah, or southern Utah, northern Utah, and actually northern Arizona. I moved to Page when I was like 5 years old. We moved to Page. My dad was a journeyman electrician and worked on the power plant there in the 70s, and then lived in Snowflake for a time as a teenager. So I'm not, I haven't always lived in larger metropolitan areas. Not that Tucson's a real large metropolitan area, but it's bigger than some other places. So I really appreciate Kent putting me in touch with y'all, and Bob, I really appreciate you reaching out. Like I said, really the main focus of our work with this unit, even though we're doing work in Pima County, is to reach out to folks in the other 8 counties that Legal Aid has a presence, right? And, some of these counties may have never heard of us because these counties are large and there's towns throughout, like up in Apache or Navajo County, we've got, there's Snowflake, there's Holbrook, there's Winslow, like it encompasses a broad area. So what we want to really do is get the word out to folks in these communities that we're here, that we're going to have a presence in the community. So we're not just going to show up, do a clinic, and then say, bye, we'll see you guys in 6 months. We want to have an ongoing presence and a relationship with folks in all of the additional 8 counties we work in, right? That means we're going to be traveling a lot. That means we're going to be putting on clinics every month, probably in whatever respective county that we're going to be in. That means we're going to be in your community, doing outreach and putting up flyers, maybe having lunch with y'all or something. Like that's what we want to do. So we want to have a presence in Pinal County and the other counties as well. And so that's what, my efforts in reaching out to Kent. It's not just, to come and do the clinics and leave. Like we want to have a presence in the community. We want you guys to know that you can call us if you have any questions or need any help or there's any concerns, right? So I can always be reached by phone. I can provide my cell phone number to some of you, and also email address. And we'll get all that out after the presentation. So Bob, I don't know how long you want me to go, if you want me to mainly talk about the work that we're going to be doing, or you want me to go into the outline. The outline's pretty thick. It's mainly for you guys to have a reference guide. If you're seeing these cases or folks are coming in to talk with you about maybe having a expungible offense, not sure.
And I did include all of the materials you sent in the meeting announcement that went out yesterday about, I
Okay.
don't know, 1 o'clock. So everybody has all of those materials. So, to me, I think, what's the 10,000 foot view of what you're doing, and what do you want us to know about what you're doing? And I think the other part of that is, how can we help? What can we do?
Okay, awesome. Awesome. So you guys have this outline put out by the Reclaim Your Future Marijuana Expungement Coalition. So I'm just going to let you guys, have that for your reference. And if you have any questions to ask me about that outline while I'm talking, please feel free to raise your hand or just jump in. That's fine. I'm more of a conversational type person. I don't like to just stand and talk. I like to have conversations. So I'm going to let you guys have this outline as a guide. And I'm going to talk primarily just kind of about what we're seeing and what we are looking to see in the future. Some issues that may have come up in this work thus far, et cetera. So the Reclaim Your Future Marijuana Expungement Coalition is a coalition that was devised under the main grantee under Proposition 207 and under the statute. Monies were set aside to fund marijuana expungement by nonprofits, right? So we've got the Arizona Justice Project, which is the grantor, and then we're a sub-grantee. Community Legal Services in Maricopa and Yuma and Yavapai County is a sub-grantee. DNA Legal Services in Coconino, I can't remember the other, and they cover part of Navajo also, is a sub-grantee. And then Arizona Justice Project has its own attorney that's also doing these cases. So together we cover all of Arizona, which means together we can one or either Maricopa or either CLS or Arizona Justice Project or DNA or Southern Arizona Legal Aid can represent people in petitions for marijuana expungement matters if they do end up going further than just filing the petition and getting it approved. We can represent individuals. We also are conducting clinics where we're trying to reach more people and help them fill out their petitions and file them on their own. So it's a clinic model and also an individual representation model. We had our first clinic here in Pima County at the Primavera Homeless Foundation. Well, they don't just deal with homeless people, they deal with a lot of people in the community, but primarily it started out as a homeless foundation. So we did it with Primavera. Andy Silverman, who leads the Conviction Set Aside and Civil Rights Restoration Clinic at the U of A College of Law. He's doing these as well, these expungements also. He and his students were there. So we put on a clinic and we helped a number of folks fill out the petitions. We don't do, at Legal Aid at this point, we don't do set-asides and civil rights restoration yet. We've got our eye out for funding, so we can include that in our unit. But we had some, like, for example, I had one gentleman who had a case, he had a marijuana case in Gila County. So I helped him fill out that petition because Southern Arizona Legal Aid covers Gila County. And then I sent him to Andy's clinic because he had a Maricopa weapons violation that he did time for. And Andy's students were able to help him fill out the set-aside paperwork. So we're kind of tag teaming with Andy on that stuff. We have our first clinic in one of the rural counties on November 6th. We're doing a clinic with Bruce Carlian, I think is his last name, how it's pronounced, the county attorney there in Navajo County. We're doing a clinic with his office at, I think it's some type of community event, maybe a community fair or county fair or something. We're doing that on November 6th. And then I'm trying to get one set up for November 5th in Apache County, working on that currently. So yeah, that's it. Does anyone have any questions at this point or anything need to be made more clear?
Paul has
Katie,
his hand up.
Yeah, Katie, I have a question. I know that for the Primavera event on Saturday, you were also granted access to the court's systems. Pinal County doesn't quite have the same availability of that. How
Yeah.
important was that court access for you all in being able to successfully assist the individuals that day?
Yeah, good question. So Sala has that court access already. So I have that, like I just hooked up to the Wi-Fi and we had that access. And Andy's clinic does. I know in the past what they've done, the Pima County Public Defender has put on set aside and civil rights restoration clinics, and they've had the clerk there, the clerk of court for Pima County Superior Court there to look things up. I don't know if that's something we could get at some point, or if that's something we could get in the rural areas. For us, so this is the stance we're taking, the legal stance with regard to the legal stance in light of the way the statute's written, right? So the way the statute's written is that the petition shall be granted, right? Unless the county attorney within 30 days opposes the petition, and then there can be a hearing, right? So our position is that we're telling folks that they need to file these petitions without the accompanying documentation. And then if the county attorney objects, we've also found in Pima County, the judge denying the petition, which we don't really think they have the statutory authority to do that, to just flat out deny it if there's no attaching documentation. But our take at this point is file the petition. If it's denied, then we'll take it from there. And at that point, we might need to jump in and represent you in that case, right? But also, like, for example, the gentleman that I talked to in Gila County, his case was kind of nuanced. So I told him, I said, it's up to you if you want to file the accompanying documentation. He didn't have anything. I told him how to get it. I looked it up on Case Lookup, but of course we can't access the actual document. And I just said, go to the Gila County clerk's office in Payson and just ask them for the information. And if you want to attach it, go ahead. If you don't, you don't. Now, in that case, I'm not representing him. I'm just like, I'm giving him maybe a little bit of advice, but primarily he's doing it on his own. So it wasn't necessary from our position to have that information in order to file the petition. Is it helpful? Heck yes, it is, right? Because if we have that information with him, I couldn't, because he was in Gila County. But if he would have been Pima County, I could have looked it up and maybe immediately said, oh, you can't file. You're absolutely ineligible, because people don't know. A lot of people don't know what they were charged with. They can't recall what they pled to. Some of these cases are years old. They no longer have the paperwork. And they certainly don't have the arrest report, right? But as far as the work we did on Saturday, it wasn't a barrier to me to not have access to that Gila County court record. Would have been helpful, absolutely. But it didn't take long to fill out the petition. It took me like 5 minutes with him. He's going to file it. And if he has problems, then he'll contact us and let us know.
Okay, yeah, it's good to know. Yeah, Pinal County does have it kind of locked down a little bit differently. There are, I myself and Kate, I think, and Kathy also have Ajax access, but they haven't really opened it up in the same way. I actually was the one who unlocked it on Saturday to that IP address at that Wi-Fi for Primavera.
Oh, you did? Okay.
Because I used to work for Pima County.
I'm sorry.
No,
sorry,
I wasn't there.
Upstairs.
I wasn't there. I don't need to be. I can do everything from the cloud. So,
Ooh,
but
you're magic.
I know. But the reason I asked about it is because I do know that it's a problem, and I think Pinal County's designed a little bit differently in the way that AOC allows that access. So it's something that I think we would want to make sure to try to coordinate. I don't know, Kent, if that's something we could work together on getting Ajax access for them on these rare occasions.
I have no problem doing that. And I think probably, as Pima County did, looping in our clerk of courts probably makes a lot of sense to have somebody there. Just so everybody's aware, I want to make a pitch for Katie and her team. We've had about over 10,000 cases that we've identified that we think are potentially eligible based on sort of an extrapolation of numbers. Pinal County Superior Court, as of about 3 weeks ago, there's been 14 successful petitions. So of 10,000, there's been 14. And I know I've had an opportunity and the privilege to speak with our clerk of courts, Rebecca Padilla. And what Becca told me is there's a lot of frustration of people because they'll come to the front desk, they'll have their paperwork filed, they'll give it to them, and then our clerk says, yeah, this isn't the right court. So they don't have Katie and Katie's team to sort of send them the right place. As Katie said, if you're in Pima County, you can't file a Gila County petition in Pima County. And in Pinal County, most of our marijuana possessions as of late are actually in the justice courts. Well, people go to Florence. That's the Superior Court. That's our main court. That's where it should go. You can't do it at Superior Court. You have to find the unique or individual justice court in which you filed. And then as Katie knows, we're in this weird position where some of our old justice courts have actually relocated and refolded up, and there's a question there. So what happens is people are getting very frustrated because they don't understand. They think they've went through it and there are all these barriers and roadblocks. That's why I think it's important that people refer these cases to Katie and her team because again, we know there's a whole lot more people that are trying. And we've actually, when I say we collectively, the county, the clerk has turned away people saying, look, we don't have any record of your case at multiples of the number of people that have actually been able to successfully file it and get it granted. And my concern is the more barrier soldier through. So I think that's part of the reason we really wanted Katie and her team to work. And, a lot of this will go through Paul and Kate and Kathy, but I think a lot of these people likely are your clients or the people that you guys are providing services to. So my hope is you don't need to shove it down their throat, but if you hear about it, if you're aware of it, if you provide a flyer to those people, it's a service that our community needs. And frankly, we're lucky that SALA covers us because otherwise I just don't know that we'd have the resources to provide these services otherwise.
Thanks, Kent. I appreciate that. And it's good to know the numbers that you've identified thus far. We want to put a clinic on in Pinal County as soon as we can. And I know that Kent, you were mentioning the community college might be a good space to have it. We could probably we bring myself and then the two staff, most likely my program manager. Those are all attorneys that can help with filling out these petitions. And then, having volunteer attorneys from Pinal County would be helpful as well. Because if you have that many that you've identified, Ken, 10,000, and that's just what you guys have identified, there's probably a lot more. So my feeling is once we start getting the word out, the flyers are out, y'all are talking about it amongst yourselves and with other community members that you're connected to. My thinking is those numbers are going to start to come out of the woodwork, right? And the folks that are coming to the court are going to become aware of it. And so we can start putting on clinics and serve a good number of these folks. Now, like I said, we're also going to be doing individuals. So if someone calls me from Pinal County, in fact, no, that wasn't it. Yeah, I actually do have a case out of Pinal County. A guy called me last week. If people are calling us directly, of course, we're going to serve them. But I think the clinics are a better way to capture a lot of folks and get a lot of petitions filed, petitions that are easily going to go through and they don't need additional assistance, right?
Katie, I am happy to report I was able to speak not with the president of CAC, our local community colleges, but the actual coordinator of all of the meeting spaces and got confirmation there's no issue. They're not going to have an issue with the topic. They're certainly willing to work with you. Again, we have tons of locations. We just, I'll get with you later, but you really just need to pick a location, whether you want to use the main campus and kind of the Coolidge Casa Grande area, if you want to use the Santan campus, the AJ campus. They were confident that all three of those would certainly meet your needs. I think even Maricopa, they thought probably would. So they have confirmed that they're absolutely willing to host. I think the decision just needs to be made. What is the best location to do the actual clinic?
Okay, fantastic. And thanks for doing that, Kent, for following up on that. And I can get with you later. Is there anyone on the call here that has a suggestion of what would be a better location? Is Casa Grande better? Is Maricopa better? What do you guys think, if you have any opinion on it?
I guess the way I think about Pinal County is that we kind of divided into 3 zones. And I think the most populous zone is kind of the central corridor with Casa Grande, Eloy, Coolidge, Florence, that kind of area. And then there's the eastern side of the county, which is the Copper Corridor, and maybe Derry and Matthews can help you coordinate over there. And then there's eastern, so that would be Maricopa and east of Casa Grande. So it's my thought would be maybe a good place to start would be Casa Grande, and then see how it goes, and then maybe move up to Santan. You know, I think that it's going to be difficult to get everybody to come to one location.
And you know what, that's fine. And as I'm thinking about it, as we're talking, I'm realizing again how huge Pinal County is. So I think that it would be a great idea to maybe do 1 month, we can do Casa Grande, another month we could do Santan, another month we could do Maricopa. I don't know if it would be helpful to maybe do Florence. So we can do that. And to let you guys know, at this point, we don't have a lot of cases. So we really have a lot of time, and we have enough staff to be putting on clinics on a regular basis. So we could hit all 3 areas. It's not a problem. If you guys think that would be helpful. Sorry, I'm trying to put in my email address here in the chat, and I'm using my phone because the computer, I couldn't get the Zoom set up, and it's just not being very helpful.
I can do that.
Okay, so I want to give you guys our website, and we have a section, we have a link on that website. We have a blog up right now. It's sazlegalaid.org. And then, so Bob, if you could put that in the chat, and then I'll also give you our phone number and the extension for the expungement unit and the email for the expungement unit. I'm also going to give you guys my personal email and extension. Okay, so that's my email address. Bob, can you put also in the chat the Legal Aid's website? So it's www.saz. Is it SAZ? Sorry, guys. Is it SAZ or SALA.org? Unfortunately, I feel bad. I don't really look at our website a whole lot, but let me punch it in real quick.
It is not solid.org.
It's www.sazlegalaid.org. So that was my email address that I gave before. Sorry. So that's the website, and it's got, let me see. I posted the blog, but I gave them the blog to post. Here we go. So yeah, so we've got the Reclaim Your Future. Reclaim Your Future is on the front page. So that's the link to the work we're doing. Our expungement project is called the Begin Again Expungement Project, and that is linked on here also. So folks can either reach us that way, where they go onto the website and they go onto the expungement project link, and then they can be directly they can get direct information about how to contact us. Like I said, you can also email me, and let me get you the expungement unit's email address. Hold on just 1 second. It's kind of an odd address for me, and I'm so used to doing my own email. So I want to give you guys my extension. My number is 520-623-9465, extension 4134. And then the extension for the expungement unit, or the number is the same, 520-623-9465. The extension is 4199. So that's directly to our expungement unit. We all are able to access the voicemail for that unit. And I'm not finding the email right now for the unit, but if you guys email me and you want the email for the unit, I can provide that to you. So I guess primarily from this group, it would be helpful for us, for you guys to get the word out to folks that you're working with in the community and other people that you connect with other agencies about the work we're doing, get our contact information out. And then once we get the clinic date and the location, get that information out as well. We'll be sending out flyers. I was supposed to email a flyer to Bob prior to the meeting, and then I was also supposed to email a flyer to Kent. Unfortunately, we've had to run the flyer by Arizona Justice Project in Phoenix. They're kind of weird about us putting our information on there because they want everyone to call the one number in Phoenix. I think it's a 1-888 number or something, where then they're routed to whatever services in the state of Arizona, whatever agency is providing the services in that county. We wanted people to directly contact us because we feel like most of the people in the rural counties are more familiar with legal aid than they are the Arizona Justice Project in Phoenix. But I'm thinking what's going to happen is the flyer I'm going to send out to you guys is probably going to have their main number on it, and people will get routed to us. So what I want you guys to have is our direct contact information. So if someone comes to you and they're like, I need this assistance, or I know someone that does, you could just direct them right to us. You don't need to go through the Arizona Justice Project number. So.
Katie, anything else? Anyone have any other questions for Katie? Well, all right. Well, thank you so much for joining us today. I think
Actually, I do
okay.
quickly. Hi, Katie.
Hi.
I justice involved individuals, and most people I work with are dealing with charges that getting a marijuana charge expunged wouldn't make that much of a difference, I guess. But I was wondering if you could just quickly give me an idea of the other kind of assistance that your organization offers.
Oh, sure. So we have an office in Casa Grande. The manager of that office is Diana Lopez Jones. She's been down there for quite some time, and they provide services to the reservation, the reservation in Pinal County. They also provide services to all of the cities and towns in Pinal County. So they provide eviction assistance, a general civil law, domestic relations, no criminal law, but yeah, all general areas of civil law they cover, including custody, landlord tenant law.
Okay, thank you.
And I can give you their number if you would like it.
Sure.
Okay. You can't do it. Hold on. Okay, you ready?
Yep.
Their number is 520-316-8076.
All right, thank you very much. And thanks for your presentation.
Yeah, no problem. You can also contact the office in Casa Grande through the website as well.
Okay, great.
Yeah, no problem. Well, thanks everyone. I hope that I can meet all of you in person. Like I said, we're going to be in, the different 8 additional counties beyond Pima County quite a bit. Our presence will be there. So, reach out if you want to talk. If you want to set up like maybe a tour of, the agency you work for, and like showing us the kind of work we do, so that we have that connection and we can, maybe better tailor any presentations to those folks. That would be great. Just reach out with anything. Like, I'm always available, to talk, and I want to learn more about the communities in Pinal County and what the greatest need is. And maybe, really in every way that we can, we want to cater our outreach to the needs of the community. So really appreciate your time. And I'll get with Kent to figure out the location for our first clinic, and I will keep Bob and Kent in the loop, and would love to meet with you guys next month as well. I think it would be helpful for us to be present at these monthly meetings, if we can work that out, Bob.
Absolutely.
Fantastic. All right, you guys all have a great day. Again, thank you for your time.
Katie, thanks for joining us today. And I think the other thing that I would like to say is that when you get the first clinic scheduled and you need assistance with promoting it, I think we all have social media networks, and we have lots of contacts through all of our networks, and I think that we can help push that messaging out.
Fantastic, Bob, because that's a huge piece. I mean, holding a clinic and having a space is awesome, but if no one knows about it, then all the snacks are going to be for us, right? So
yeah, understood.
All right, thanks, guys.
So thanks.
Bye.
And I'm guessing that Kent is no longer with us, so I'm guessing that the rest of the agenda will go very quickly now. So we can move back to business, and we have one new member application, and that's Stand Up AJ. And I know Shelley, you're on the call, and I just wanted to give you a moment to talk a little bit about Stand Up AJ and why you think it's important to join the Wellness Alliance.
Morning, everyone. Stand Up AJ is Apache Junction's Substance Use Prevention Coalition. We are mentoring with Tempe, and we have some funding. And we are coming along quickly and learning a lot this last year. We've built a lot of capacity, and we've gotten trainings in the strategic prevention framework. We are in the process of doing like a draft of a needs assessment and an implementation plan that will last for the next year in preparation for applying for the DFC grant in the spring. Shana Malone is helping us, and we're going to be putting out a survey soon. So we're just trying to network and do as much as we can to get some good boots on the ground and get the word out there. And we've actually gotten to practice an implementation plan with the fentanyl toolkit that SACLAS put out. So we did a lot in the month of September to get that message out that kids need to be aware that those little blue pills may not be what people tell them they are. So this work is just hugely important, and we want to do everything that we can. And your alliance is, we were actually a part of the alliance as AJDPC in the past. So this has been a long-standing connection that we've had, and we want to make sure we continue that. And I want to, every time I come to one of these meetings, I take a nugget away or a huge piece away that I bring back to the coalition, and we see what we can do to utilize that information. So, and whatever we can do to help you all, we're here to help you as well. So.
Well, outstanding. Thanks, Shelley. And at this point, I don't know that we need this is a fairly informal group. So I'm guessing that there are no objections for Shelley joining. If so, now's the time. Hearing none, I think you're now official, so we'll add you to the list. Paula gives you a big thumb up, so in my book, that counts.
Thank you.
So right on, welcome. So we do have several committees, and I think we'll just have primarily brief updates for today. And if you haven't had a chance to complete the Pinal County Wellness Alliance process survey. I did put that link into the chat box, and if you could just, it's not very long, it's not very complicated, and it would be really, really helpful to help us think about how we can improve this group and the process that we use to have our meetings. So if you could take a few minutes and do that, we'd sure appreciate it. That said, I'd like to hand it over to Eliza and Jan for a quick update on the Mental Health Substance Use Disorder Committee.
Jan, I don't know whether you want me to go ahead or are you on, Jan?
Yeah, go ahead. I don't have a lot to add to this week.
Yeah, we don't have a ton for this month, but participated in Bob's kind of strategic planning work group and hope that everybody does take that survey. And then we are planning on spinning up again this kind of data work group. We've been working to with partners across the state to really assess what this My Sidewalk platform that you've been hearing about for the past few months can do for us. I think we've got a better vision now after a few meetings with the vendor and with other partners that are using the system. So our next step is to convene. We had 2 brave volunteers willing to participate with us, and if anyone else on the line is interested in really seeing how this platform works, it's a national source of data that we can search and pull information from and compile reports. And we're also finding that we have the ability to upload our own surveys, information gathered from across the state. So we're working with the vendor to upload things like Arizona Youth Survey and other information that really we and our partners across the state can use to better inform the annual reports that we're creating, the data-driven decisions, and justify a lot of the actions that we have related to our priority areas, including substance use disorder and mental health, behavioral health. So our next steps again are really to try to bring a group together and figure out where are the data points we're missing or that are needed, and how can we as the health district help to support the data needs of our partners. So if anybody is interested, please throw your name in the chat box or reach out to me directly, and we will hope to convene that group this month.
Great,
Jan,
thank you.
Thank you. Jan, did you want to add anything?
I just want to thank everybody for their patience. I know that in the past, our public health department really worked on surveillance with opioids and had a lot of handy data. And fortunately, the state is still continuing to do that. So it's not as though we don't have any data. But because of COVID, we've kind of had to, reassess and move some folks around and things like that. We're getting back to the data. We're getting back to where we're having more time to work on that type of thing. But I just appreciate everybody being patient with us in the meantime. And that's about it.
Jan, it's not like there's anything distracting going on right now. So gotcha. So Pinal Community Reentry Project, just a couple of quick updates. We did receive funding for the balance of this federal fiscal year. So the funding for our Pinal County Reentry Project ends on Thursday. We have a verbal commitment for renewed funding for next year, for the second year of the project. So we don't have that in the bag yet, but I'm super excited about that. I will also say that I'm saddened to report that Alfredo Gonzalez, who's been kind of the champion for reentry this past year and has been the champion for the SAMHSA Gains Reentry Community of Practice that we've been participating in the national level, Alfredo has accepted a reentry only position in a nonprofit in Boston, Massachusetts, and he will be departing at the end of the week. So we'll be posting that position shortly, and we'll be looking for a great candidate to fill his very big shoes. So that's the update on the reentry project. And moving on, Cinda and the Housing Committee.
Hi guys. So for the housing subcommittee, currently right now, we are creating a singular email with verbiage for community stakeholders. We didn't meet last month, but we will be meeting this month. We're also looking for someone that is also wanting to assist in running this with me, as Alfredo is unfortunately leaving. So he will not be able to run this subcommittee with me. So if anybody is interested, please let us know, and we'll work towards that.
Great, thanks, Cinda. And again, process improvement. We, our small committee put together, I think, a really nice survey. We really want to kind of get, 360-degree feedback. How are we doing? What do you think of the meetings, presentations, agenda? What's valuable in this for you, and how can we make it even more valuable? So we really want to take a good hard look at that. One of the things that came up in the committee conversation was that with the establishing of committees, that we have this Wellness Alliance meeting on a monthly basis really doesn't give a whole lot of time for committees to meet and get their work done. So we were kind of thinking about, as committees get more established, might we change the cadence of the Wellness Alliance meeting from a monthly meeting to something new and different? But I think we kind of want to look at the results of the survey together, and then also bring that back to this group for any kind of decision making. So that being said, again, if you can get the survey done, it would be greatly appreciated. And then last quick committee update. We've convened and had an initial conversation about presenting to, say, the Board of Supervisors in November. And, I think we'd like to talk a little bit about our accomplishments, what we've done over the past couple of years, and where we're headed for the future. And I think that, like, the survey results could be a big part of what that looks like. I think also we're really looking to the Board of Supervisors as, can we serve as a vehicle for them if they have interests or needs or wants? Is there anything that we can do to support their work as well? So, so I think that we're interested in working toward making this organization a bit more viable and hopefully a bit more useful to everybody. So next on the agenda, advocacy and public policy. We had a nice update from Kent. Does anyone have anything else to add for advocacy or public policy? Hearing no updates, I think we can move on to local trends and community updates. Anyone have anything to share? I think Sarah might have some news.
I will always share, unless you know something that I don't. So Oxford House, we're a nonprofit member-run recovery homes, and we opened 2 in Casa Grande this summer. We opened a women's house for 10 women on June 1st, and then a men's house for 9 men on August 1st. The Women's House is now officially a Women with Children's House. So we're really, we had a 9-month pregnant woman apply to be with us. She was in another facility locally where she was not going to be allowed to have her child. And so the house got together and decided that we would accept her. And so we're going to have a new baby here in about 2 weeks, which is really exciting. But that means that we also will accept applications for women who currently have children. And usually it's 2 children, maximum of 2 children under the age of 10 at the time of interview. I'm currently viewing other houses. We're hoping to open 2 more, hopefully by the end of the calendar year. As soon as possible, really, because wow, it took, I worked in Pima County in Tucson for over a year, and it took that long to get one woman's house filled and stable. And so, and the fact that our 10-person women's house here is full and stable so quickly is really amazing. And I think the houses are going to do really well here, and we're just going to continue to open them as quickly as we can. So if anybody sees or hears about any really big, like over 3,000 square feet, 7-bedroom giant houses, let me know. If anybody knows any property or landlords that would be interested in discussing the benefits of renting to Oxford House, I would be happy to speak with them. And one of Bob's employees very generously donated a whole bunch of furniture to us recently, and I'm very grateful for that. If anyone is moving or has friends that are moving, everything is tax deductible. I can provide donation receipts, and we can always use furniture and any kind of household items. Did I forget something, Bob? Okay.
Oh, no, I was just excited for you because you've been given the green light to expand to identify 2 more houses. So
Yep.
that's cool.
Yeah.
Right on. Other updates, other announcements? Thanks, Sarah. Darian, don't you have something going on soon in the Copper Corridor, maybe?
Certainly do. Could always rely on you for that, Bob. Appreciate the call out. Yes, we do. So we're hosting National Night Out in the Copper Corridor. We'll be in 4 different locations. So it'll be Superior, we'll be in Mammoth, Salmon Well, and also in Oracle. It's a great opportunity to be able to connect with families and youth, to provide resources for them and build and enhance relationships with first responders. It's a dire need in the Copper Corridors. Unfortunately, a lot of the departments are sorely lacking in support. So there hasn't been a huge community response as far as being able to build relationships with them. So it'll be a great fun event. We'll have free food for them. We'll have games for youth, activities. A lot of them will be educational too. So if you want to provide resources, we're giving out resource bags. I know Bob is helping out in AmeriCorps Vista as well. We have a few that are on the Wellness Alliance that are too. So if you want to reach out to me, I'll put my email in the chat. If you want to provide resources or be there as a resource booth, we'll be following the CDC guidelines for our events. So just let me know. Thank you, Bob.
Right on.
Darian, what is the date and time for that event?
Oh, good question, sir. Sorry, it's October 5th, and it will be from 4 p.m. to 8 p.m.
And you're going to have different ones in all those locations you mentioned?
Yes.
Okay.
So
Could you mention them one more time? Superior.
Yep. So Superior, Mammoth, Salmon Well, and Oracle.
Thank you.
Thank you, Darian. Any other announcements? Community updates. I know that we have Silent Witness Night tonight in Casa Grande, which is something that's put on by our police foundation here. And I think it'll be interesting to see if the community comes out and kind of what that looks like. I know these public events are kind of few and far between. Last month, we talked a little bit about doing a community health fair in partnership with the mall in Casa Grande, and based on everybody's response for a survey, everybody just thought it was too soon, too much, like, things were too unpredictable with COVID. So perhaps that's something that we can revisit in the spring. Two other quick updates from the Casa Grande Alliance, and that is that last spring we submitted an application in partnership with the elementary school district to participate in a national child traumatic stress network, which is a national network of universities that provide resources to schools and communities for traumatic events. But they're put together a new national learning collaborative, and the whole goal of the National Learning Collaborative is to build safe, supportive schools. And we were one of 15 sites selected around the country to participate in this new national collaboratives. So we're excited about that. We have the orientation tomorrow. I'm sure that we'll have updates on progress, and I think that the application of what we do in this national collaborative is certainly something that can hopefully help inform other schools and other school districts. We're super excited about that. And I think it's going to be a lot of work, and it's going to be a lot of work for the classroom teachers and that kind of thing. Second thing I wanted to mention is that especially with Choya Elementary School, so Choya Elementary and Cactus Middle are the two schools that will be targeting the activity for participating in the National Collaborative. But I think that the lessons we learn from how they implement and grow will be pretty universal. And we've done tons of trauma-informed and resilience building and childhood adversity training with the Choya staff, and it really feels like the attitude and the mood is changing. So that's it's interesting to see that happen with a group of educators. And somebody had a hand up, and now it's gone.
Hi, Bob. It's Christy from Mercy Care.
Hey, Christy.
Hi. So I just kind of wanted, and I'm sorry, it took me a while to open up the attachments I was looking for so I could give you the information, but I just wanted to let everybody know that there are some trainings available through ASU that are actually virtual. So the first one is a virtual human trafficking awareness training on Tuesday, November 9th from 10 a.m. to noon. And so I'm just really trying to get the word out there that there are these trainings available. And there's also going to be a symposium on, let me see if I can find the date. So it's actually a 2-day symposium, Wednesday and Thursday, October 20th through the 21st from 9 a.m. to 2 p.m. It's a Zoom webinar, and there's going to be speakers talking about labor trafficking. Both of these, once again, are through ASU, and they are free. I just kind of wanted to get the word out there and let everybody know that these trainings are available.
Thanks, Christy. If you could send me the information about that, I'd be happy to include it in the follow-up for this meeting.
Sure, of course, not a problem. I'll send it over to you right now.
That'd be great. And I would add one other something that's in development right now is the Arizona Adverse Childhood Experiences Consortium is putting together their annual summit in partnership with Prevent Child Abuse Arizona, and that's going to be mid-December. It's going to be virtual using the Whova platform, but we've just secured Donna Jackson Nakasawa, who is a very prolific author, and her latest book is The Angel and the Assassin. And she's going to be our one of our keynote speakers. And the subtext of this book is that it's the tiny brain cell that changed the course of medicine. So it'll be interesting to hear from Donna. And then I think the last thing from me is we're still working on building about 2,000 school supply kits for the elementary school students here, and we're short just a few items. We hit Walmart in Casa Grande last week, and we bought 5,000 spiral notebooks at $1/4 a piece. So we got a smoking deal there, but we're still looking for water bottles, stress balls, scissors, Post-it notes, glue sticks, dry erase markers, crayons, and backpacks would be really cool too. So if you happen to have a storeroom with boxes of stress balls, or your organizational branded water bottles or anything like that that you're willing to contribute, we're still in the process of getting the school supply outs to the kids, and we'll probably be doing that for the next month or so. Shelley, your hand is up.
Hi, I just wanted to mention something that came out of the drug summit yesterday. Their first speaker was from the Betty Ford Children's Center in Coachella, California. And he was saying that they have a virtual component to their program now, and they serve kids 7 to 12 years old that have been impacted by addiction in any way. And there's no, they will never turn a child away because of inability to pay. So I don't have contact information right this minute, but we're supposed to be getting emailed out all of the information from the summit yesterday. So as soon as I get that, I will pass that along to you, but I wanted to get the word out about that.
Great. And when you get that, well, we'll get it here as well, but I'll work on remembering to include that in the follow-up as well. All right, folks. Anything else for the good of the order this morning? If not, our next meeting is October 26th at 9 a.m. And we sure appreciate your time and attention this morning. It was great that Katie came from Southern Arizona Legal Aid and talked with us about the expungement effort that's going on statewide. And it sure feels like we should be able to help get her connected with folks in Pinal County. So if there is nothing else for today, then see y'all next month. Hi, Marla. Take care, everybody.
Bye, everybody.